I'm Du Bois Bowman, Dean of the University of Michigan School of Public Health. And I want to say a sincere and huge thank you to all of the public health professionals, practitioners, and officers across Michigan who are working to keep our state safe. You've been working so hard since the outset of the pandemic, selflessly giving your time and talents in order to protect Michigan communities. During the pandemic, those of us who work in public health were called upon to act in ways and with an urgency that we might never have before. What I've seen time and time again is our public health professionals stepping up to do what is necessary to keep our communities safe. Thank you for representing the best of public health. For every step of progress that we make as a society, for every step that we take safely getting back to many pre-pandemic activities that we all cherish, we know that these steps will be because of your hard work, your commitment to protecting the health of all of us. Our school is so grateful for everything that you've done and all that you continue to do on behalf of all of us. Thank you.
We've worked the past 18 months with MDHHS to build the My Symptoms app, the My Safe Start map, and the My Lighthouse to hopefully help you in local public health do the incredibly important work that you do. And I wanted to thank you for, everything that you're doing, from the data crunching to making the tough policy calls, forging through the incredible adversity that we know is been cropping up lately, but keeping your eye on the really big prize of helping everybody get safely through this pandemic, young and old. Thank you. Just thank you so much for everything that you do.
I'd like to take a moment to say thank you to all public health workers in Michigan and all over the world for your work in trying to keep our families, our cities, our campuses, our neighborhoods safe. A special shout out to behind-the-scene architects who helped with collection and analysis of data and modeling. Thank you so much.
The students, staff, and faculty of EHS thank all the public health professionals on the front lines of this pandemic. We recognize your hard work in the hospitals, in the laboratories, and in the field to help reduce the impact of COVID-19. Please take care of yourselves. You and your work are so greatly appreciated.
On behalf of everyone in the Department of Epidemiology, I want to thank you for all that you've done and all the sacrifices that you've made over the past year and a half to promote public health and to keep us safe. We're so grateful for the work that you're doing, and we appreciate your service to the state of Michigan and to the country.
I am really pleased to be able to have this chance to thank our public health workers in communities and at the state level in Michigan for all you've done, all you're doing, but also all you've done over the last 18 months. Keeping on top of the numbers, AKA the data. Keeping on top of the numbers is how we know exactly where we are in terms of understanding the pandemic. And then, thank you for everything you've done to come up with the guidelines, come up with the policies, and most particularly take the actions that were needed to protect the health of all of us. Thank you.
When you got into public health practice, you probably were not expecting to deal with a pandemic. But I would argue that what you are doing right now to help us all deal with this pandemic is perhaps the most important, critical function of our public health system. The data that you're gathering, the information that you're sharing, and the guidance that you're giving is very important. Of course, researchers like myself rely heavily on the information you're gathering and disseminating. But I also know the general public in both your communities and around the nation are also paying attention. Historically, public health has not been highly valued. Change is slow, but it is coming, and our leaders and the public in general are coming to recognize the value of a well-educated, competent, and compassionate public health system. Thank you again for all your work.
Your efforts, dedication, and hard work are greatly appreciated. Please know that we support you, we see you, and we thank you.
Thank you so much for everything that you are doing and everything you have sacrificed to help people through this nightmare. These past 18 months have required so much of healthcare professionals, and we can never express enough our gratitude for the selfless efforts you have made. I am sorry that people are not willing to do everything they can to ease this burden. Most people will never know the lengths that you went to in service of others. And I want you to know that so many of us see you and appreciate you. Please don't forget to also take care of yourself. Thank you.